Risperdal is a widely used antipsychotic medication that has been the subject of extensive scientific research. In this video, we will dive into the science and safety of Risperdal, exploring its benefits and potential side effects. As an expert in the field, I'm excited to share with you the latest findings on how Risperdal works and its effectiveness in treating mental health conditions such as schizophrenia and bipolar disorder. With its unique mechanism of action, Risperdal has shown promising results in alleviating symptoms and improving quality of life for many patients. What is Risperdal? Risperdal, also known by its generic name risperidone, is an antipsychotic medication that belongs to a class of drugs called atypical antipsychotics. It is primarily used to treat mental health conditions such as schizophrenia, bipolar disorder, and irritability associated with autism spectrum disorders. Risperdal works by affecting the levels of certain neurotransmitters in the brain, specifically dopamine and serotonin. The benefits of Risperdal for treating mental health conditions. Risperdal has proven to be highly effective in managing the symptoms of various mental health conditions. For individuals with schizophrenia, Risperdal can help reduce hallucinations, delusions, and disorganized thinking. It can also improve overall cognitive functioning and social interactions. In bipolar disorder, Risperdal is often used as a mood stabilizer to prevent episodes of mania and depression. It can help regulate mood swings and provide stability in daily life. Additionally, Risperdal has been found to be beneficial in reducing irritability and aggression in individuals with autism spectrum disorders. Understanding the science behind Risperdal. To fully grasp the science behind Risperdal, it's important to understand its mechanism of action. Risperdal works by blocking certain dopamine and serotonin receptors in the brain, specifically the D2 and 5-HT2A receptors. By doing so, it helps to restore the balance of these neurotransmitters, which are involved in regulating mood, perception, and cognition. The precise way in which Risperdal exerts its antipsychotic effects is not fully understood. However, it is believed that its ability to antagonize these receptors contributes to the reduction of psychotic symptoms. Additionally, Risperdal has been reported to have an affinity for alpha-adrenergic and histamine H1 receptors, which may also play a role in its therapeutic effects. Safety considerations when using Risperdal. While Risperdal has proven to be effective in treating various mental health conditions, it's crucial to discuss the safety considerations associated with its use. Like any medication, Risperdal carries the risk of potential side effects. However, it's important to note that the benefits of treatment often outweigh the risks, especially when closely monitored by a healthcare professional. Common side effects of Risperdal can include drowsiness, dizziness, weight gain, and changes in metabolism. These side effects are generally mild and transient, and they tend to improve over time. However, it's essential to monitor any changes in weight, blood pressure, and blood sugar levels, as Risperdal can cause metabolic changes that may increase the risk of developing conditions such as diabetes and cardiovascular disease. Common side effects of Risperdal. In addition to the common side effects mentioned earlier, Risperdal may also cause extrapyramidal symptoms, EPS, such as muscle stiffness, tremors, and restlessness. These symptoms are more commonly associated with the use of typical antipsychotic medications, but they can still occur with Risperdal. However, the incidence and severity of EPS are generally lower with atypical antipsychotics like Risperdal. Another potential side effect of Risperdal is hyperprolactinemia, which is an increase in the hormone prolactin. This can lead to symptoms such as menstrual irregularities, breast enlargement or discharge, and sexual dysfunction. It's important to regularly monitor prolactin levels and address any concerns with your healthcare provider. Long-term effects and risks of Risperdal. When used for an extended period, Risperdal may carry some long-term risks. One concern is the potential for tardive dyskinesia, a condition characterized by involuntary movements, typically of the face and tongue. The risk of developing tardive dyskinesia is generally higher with typical antipsychotics, but it can still occur with atypical antipsychotics like Risperdal. Regular monitoring and early detection are crucial to managing this condition. There have also been reports of Risperdal potentially increasing the risk of stroke and mortality in elderly patients with dementia-related psychosis. As a result, Risperdal is not recommended for this population. It's essential to discuss the potential risks and benefits with your healthcare provider before starting or continuing Risperdal treatment. How to properly use Risperdal. To ensure the safe and effective use of Risperdal, it's essential to follow the prescribed dosage and instructions provided by your healthcare provider. Risperdal is available in several forms, including tablets, oral solution, and long-acting injections. The appropriate formulation and dosage will depend on your specific condition and treatment goals. It's crucial not to abruptly stop taking Risperdal without consulting your healthcare provider. Sudden discontinuation can lead to withdrawal symptoms and a potential re-emergence of symptoms. If you have concerns about continuing or discontinuing Risperdal, discuss them with your healthcare provider to determine the best course of action. Alternatives to Risperdal for mental health treatment. While Risperdal has proven to be effective for many individuals, it's not the only option available for mental health treatment. There are several other atypical antipsychotics on the market that may be suitable alternatives, such as Abilify, Zyprexa, and Seroquel. These medications have similar mechanisms of action and can be effective in managing symptoms. However, the choice of medication will depend on individual factors and should be made in consultation with a healthcare provider. Additionally, non-pharmacological interventions such as therapy, counseling, and lifestyle changes can be beneficial in conjunction with medication. It's essential to explore all available treatment options and work with your healthcare provider to develop a comprehensive plan that suits your specific needs. Consultation and prescription process for Risperdal. Before starting Risperdal or any antipsychotic medication, it's important to consult with a healthcare provider who specializes in mental health. They will conduct a thorough evaluation, including a medical history, symptoms assessment, and potentially some diagnostic tests. Based on this evaluation, they will determine if Risperdal is an appropriate treatment option, taking into consideration the potential benefits and risks. If Risperdal is prescribed, it's essential to regularly follow up with your healthcare provider to monitor the effectiveness of the medication and address any concerns or side effects that may arise. Open and honest communication with your healthcare provider is crucial in optimizing your treatment plan and ensuring your overall well-being. Conclusion: weighing the pros and cons of Risperdal for your mental health journey. Risperdal is a powerful medication that can provide significant benefits for individuals with mental health conditions such as schizophrenia, bipolar disorder, and autism spectrum disorders. Its unique mechanism of action and the extensive scientific research behind it make it a valuable tool in managing symptoms and improving quality of life. While Risperdal does come with potential side effects and long-term risks, these can often be managed through close monitoring and collaboration with a healthcare provider. The decision to use Risperdal or any medication should be made in consultation with a healthcare provider, taking into consideration the individual's specific needs and circumstances. It's crucial to weigh the potential benefits against the potential risks and make an informed decision that aligns with your mental health journey. Remember, no two individuals are the same, and treatment plans should be tailored to meet your unique needs. With the right guidance and support, Risperdal can be a valuable tool in your journey towards improved mental well-being. By understanding the science and safety behind Risperdal, you are equipped with the knowledge to engage in meaningful discussions with healthcare professionals and make well-informed decisions about your mental health treatment. Remember, you are not alone in this journey, and there is support available to help you navigate the path to better mental health. Thanks for watching.